The Michigan Innovations in Care Coordination team has prepared a video to discuss improving the workflow and care coordination for patients with ASD. We're going to be focusing on integrating the Mchat-R and RF with the patient education genius. So my name is Krista Clancy, and I just want to do a quick introduction. I'm the co-PI for the Michigan Innovations in Care Coordination Grant. My role on this team is as the ASD content expert, and I'm going to review the system of care for ASD screening, diagnosis, and treatment, and the innovative ways that we are proposing to improve upon that.
Hi, I'm Danielle Baumgartner. I'm a Senior Project Coordinator for the Michigan Innovations in Care Coordination Project, and I will be featured in a few videos throughout this training, kind of walking you through the Patient Education Genius system and some of the ins and outs of that. And so I'm introducing myself live virtually.
All right, so to get us started, the purpose of this video is we are going to provide an overview training for our current partners. And we also have put this video together in hopes that it will assist with recruitment of other provider partners to the MICC project. So as you're watching this, if there's other people that you think would benefit from this system, certainly please let us know and we will try to get in contact with them. So what is MICC? MICC is the Michigan Innovations in Care Coordination. This is a project that's been funded by the Michigan Health Endowment Fund. It's a collaboration between parents, providers, payers, advocates, and community leaders surrounding autism services and the system of care in which those services are provided. Our goal within this project is to improve the ASD services through coordination of care, provider workflow within that system of care that we have, as well as patient engagement. So just a quick introduction. I want to start by discussing PEG. PEG is termed the Patient Education Genius, and our team has partnered with the PEG team to help improve workflow and patient engagement. So a little bit of background about them. They are a healthcare technology company. The goal that they have is to improve communication for medical providers with the populations that they care for. They also focus on improving operational efficiency, data collection, financial performance, as well as successful engagement of clients. We have collaborated with them to help build a platform to automatize some workflow that's related to early screening, diagnosis, and referral to services for autism. You can see here is their website. If you're interested in going, you can go ahead and plug that in, or you can do a Google search for Patient Education Genius, and you should end up at the same spot. So next, we're going to watch a quick video on how to log in, what our survey looks like and where to find it within the dashboard, as well as the tracking and the resource repository locations that we're going to talk about a little bit later.
So what I'm going to be showing you right now is how to log into the Patient Education Genius system. You're going to start here by accessing the link that we'll provide for you. You will have a username and password provided to you. I'm going to go start by logging in with the WSU username, user account, and their password. You click the sign in with email. I will warn you, sometimes it takes a little bit of time. I think they're maybe like 5 to 10 seconds. It's thinking right now, as you can tell, loading. Great, now we're here. We're at the Patient Education Genius homepage. Over here on the left-hand side, you have your surveys and your resource repository materials that you will send to your families as needed. Here's the MChat survey. I will show you how to demo that. I will demo that later on in the presentation. Up here in the right-hand corner, you also can look at tracking to see what's been sent to people and whether or not they have opened your account, and that's how you'll sign out. Going back to your library takes you back to that homepage where we currently don't have anything favorited, but this is our PEG homepage, and we'll be showing you a bunch of other things on this homepage as we continue throughout this training.
Okay, so the next thing that I want to discuss with you before we get started on the demo on how everything works and the system that we've created is our team started by taking a look at what the current system of care is for autism services. So as you can see, this is a very detailed map of what that looks like. I'm actually going to, I'm going to go ahead and zoom in here. just so that you can kind of take a look at what some of these things are. But in order for us to get started, we wanted to really think about, all right, what are all the steps that we need to take a look at, and what can we do to add some automation to this particular workflow using the PEG technology? So just to get us started, the family is going to start with an MChat. So it used to be that at the clinics that we worked with, the MChat was given in a paper format, and then the information was not easily stored and transferred for later use. So in this case, we're going to be using PEG, and we are going to have two different ways that we can get this survey in an electronic form to the families that will also save save time for the families, as well as save time for the physicians in administering this. So we can either send this out with a text message, or the physician is able to send this out through email, and we're going to show you what all of that looks like. So once the family fills out that survey, the next step in this chain is that the data is collected and that information is presented on a dashboard. We're going to use a Google spreadsheet, and all of this information is going to be stored through a HIPAA compliant system. PEG uses this type of system with a lot of different medical providers with their protected information. So this is definitely something that we have looked into. So anyways, the data gets stored, and then the system itself analyzes the data to determine whether or not the MChat has a concern or not. And based on that, the technology then makes a decision on different things that have to happen. So we're going to go through how the Mchat-R versus the Mchat-RF kind of interface with each other, and then other types of things that we can use to transfer information to the Medicaid services, as well as share information with the family to keep them engaged. So as you can see, this is pretty complex. And then we come down here to step 2, which is our coordination of care piece, where we're going to talk a little bit about the handoff between our Wayne State University clinic partner and DWIHN, which is one of the areas that we've identified as a barrier in making sure that families are able to get into services quickly. So DWIHN is going to be alerted immediately that somebody is qualified and interested in moving forward with getting evaluated for ASD services, and then the family is going to be contacted with a welcome message, and then followed up with a phone screen, as they typically would do. The information is also going to be automatically transferred. So DWIHN, as you'll see in this demonstration, will also have information from the data that's been collected. And then the rest of this is the rest of the system of care, where there will be follow-up medical evaluation, and then entry into services. And then we've also created a couple of different mechanisms to then monitor that service and the satisfaction that the parents have in receiving those services. So in order to get us started, we really needed to start with that overview system of care, and to really organize which pieces we needed to change and which pieces were going to remain the same. So we're going to discuss those things in detail. So to get us started, we're going to start with the step 1, which can happen in either a text message, as I said, or an email. So we're going to start with a demonstration of what that text message looks like. So if the physician's office is interested in providing families with information of getting a text to number, which is basically, if you see here, if you text this number 48355, and then you put MChat in the message section down there, then that will get you access to the survey. So the MChat survey would then be sent directly to your phone. So if physicians want to give this information out as part of registration, or if they want to send this information ahead of time to the families, or have it available in the lobby so that families can go ahead and get the service survey sent directly to their phone, this is what it would look like, and this is what the families would receive immediately back from that text to message. So if the family does not fill out the MChat before entering the office using the text to number, or for some reason, the physician decides that that's not a good way to get that information to the family, then they can also send a survey directly to the family via text or via email by going into the PEG dashboard and then entering that information. So next, we're going to see a PEG demonstration on the following slides. We're going to start with a video demonstration of how to actually send the survey through email or text through the dashboard. And then we're also going to take a look at what that survey looks like, what the content looks like within the PEG dashboard. And then we'll follow up with a screenshot of the message that you would see sent to the family's phone or email after that.
What I'm going to show you now is how a provider would log into Patient Education Genius homepage and how they will send the Mchat-R survey. So again, this is your homepage. You're going to go over on this left-hand side. You're going to choose this folder that says Mchat-R. You're going to click on it here. This is how the folders appear. So you can send the information to a patient. You're going to click the send button here. You can enter in a phone number and you want to, or an email address, and you want to separate it out by a comma. You can do multiple, you can send to multiple places, a phone, an email. I'm going to show here is how we'll send it to my email address. Again, you can add more than one. You can add in a phone number. You can add in additional emails. But for the for this example, I'm just going to show you how I send it to my email. You click send. So the Mchat-R survey is going to be sent to my email. It says success. Your patient education materials were sent successfully. Okay, I'm also going to then pull up the email that I receive and I will bring it over to the screen that I'm sharing. So if you just give me a moment, it's currently in the cloud. But it can sometimes take a little bit of time to get in an email box, but it's actually pretty quick. So there's the email that you would receive, a message from DWIHN Health. So a patient would click on the message and this is what's going to pop up. They are then going to see the survey for them to complete, the DWIHN logo, some advertising information for early on. And then if they click here on the survey, it's going to take them to the survey that we've shown you earlier in this presentation, the Mchat-R form, again, the consent information, and then their information that they'll go ahead and start entering for filling out the Mchat form. And they scroll all the way down here and that's how they'll submit it. So again, that is how you're going to go into the folder and you're going to send it to a patient that way. So you can also view what you're sending to them by clicking that view button. It'll show you what they're going to see. That's another feature. And I believe that's it for now.
Okay, so if you go in and you log into the dashboard and you send the family the survey, this is what they're going to see on their phone. So they're going to see a link here to click. And then once they click that, then as you can see with Danielle's demonstration, it'll open up to this information here. I just want to bring your attention. This is the logo of the clinic. So anything that's sent directly to the families will have the physician's logo. So it helps the families know where the information is coming from. This information down here, if you send more than one thing, which we're going to demonstrate later on, it shows you how much you've actually completed of that in case you have to stop and come back to it. And this view button is what you would click in order to actually view the survey or whatever information the family is sent. The other pieces below are actually advertisements. So we added two things that we thought were pertinent. One is the Wayne County Medicaid webpage, and the other is the Early On webpage, so that families who have young children who are considering services would have information on those two things going forward. So this is what it looks like on your phone. So very similar to what Danielle showed. One thing that I think is important, we're going to discuss this parent consent here in a little bit. This is something that we're doing for research purposes, so it's necessary to have it included in our survey at this time. But it is a little bit lengthy, so we'll talk about that in a bit. The other thing that I think is really a nice feature is that as you're filling in all of your patient information, like your name and your address, if you're doing this on a smartphone and on a computer that has your information stored, it is relatively quick because as you click on here, it automatically fills in all of the content, which makes this a really easy way to kind of get all of this information entered in. Another really great feature from PEG is that they have a remind function. So if this is something that you sent your family ahead of time and they have not yet filled it out, the PEG program is automatically sent right now or automatically set right now so that it will send out a reminder that they have not yet completed their survey, and they will do this up to 3 times. They'll wait in between reminders for 48 hours, but this is an automatic feature. It can also be changed. So if you decide that your reminder needs to go out maybe once a week or once every 24 hours or at a different time, you can certainly do that. And you can also change the number of reminders. So that's something that clinics can adapt. But this is kind of how we have it set up right now. So really great feature from PEG that we think will be really helpful in making sure that families can get these things done. So moving on to the consent, as I said, because the MICC team is evaluating the effectiveness of using PEG to improve the workflow and the patient engagement portions of this, we really do need to make sure that they start with the survey with this consent form. So the consent form basically says that they're consenting to completing the MCHAT survey, they're consenting to coordination of care between their physician and DWIHN. This can be lengthy, as I said. Families may need assistance with the consent form. It may be something that as a physician, you decide that you want to review the consent form together in their office. So rather than sending this information to certain families, you may want to send it immediately through your dashboard and then have families maybe take a look at the consent form with you and then go ahead and complete the survey on their own while you're doing other things. But I think it's important that that you know this ahead of time so that you can evaluate each family and determine what's the best way to present that information based on what you know about them. So moving on, the family or the patient is going to complete the Mchat-R or RF, and we'll talk a little bit about that. And then as they complete the questions on the form is automatically scored. So if the Mchat-R form is scored as neutral, then the system is going to automatically generate the questions that are needed for the Mchat-RF, which is the follow-up survey. So as the family goes forward, depending on how they answer questions and which questions they answer, that will then determine which follow-up questions then are popped up based on the way that the survey is originally designed. So after all of that is complete, the data is going to then be available in the Google dashboard for you to review once they hit the submit button. It is really important that families hit the submit button because the data is not saved and it won't automatically save a portion of it unless the submit button is completed. So the families need to have the time allowed to go ahead and fill this out in one setting. It's not going to automatically disappear if they stop for a couple of minutes, but in order to get the data to the Google dashboard for the data review, the family has to hit the submit button at the end. So now we're going to take a look at another PEG demo on the next slide, and this is going to show providers how they can actually review the data once it's in.
Hi again, it's Danielle. At this point in the training, I'm going to show you the Google spreadsheet. That's what I'm sharing with you all right now. This is how a provider will view the information after a family or patient completes the Mchat survey that they provide to them. This is how the fields and the information are going to show up on the back end. Each of the provider offices is going to be given a unique login so that they can log into their Google spreadsheet with their username and password. We're going to provide that to you all in a user quick reference guide. So that'll be provided to you so that you can have access to this Google sheet. But after a parent and family fills out this Mchat survey, here's some of the demographic information that's going to show up. And if you continue to scroll over, you will get to the actual Mchat questions. They begin here in column V. And the ones that are in yellow, you'll see are the ones that are reverse scored, questions 2, 5, and I believe question 12. As you continue to scroll over, the information and how a family fills out the survey is going to be down here. These are just test surveys that we've completed out or that we've filled out to test the survey. And as you get over here to column AP, the total Mchat score is going to be right here. So this is going to be the total score for the first 20 questions. And if patient scores in that neutral range, they're going to automatically get the questions for the Mchat-RF. And again, if you continue to scroll over here, you're going to see some of the questions for the Mchat-RF. And if a person leaves any of the fields blank while filling it out, it's also going to show up blank on this spreadsheet. So again, we'll continue to scroll over. Some of the fields are left blank. So again, they're blank on the spreadsheet. If we continue to scroll over all the way to the right, there will be like a total pass-fail column that we're still going to have the PEG team make a few last minute updates, and they're going to add that information in here. So there'll be a total pass-fail column for quick reference for a provider office. And so that's some of the changes that we're going to be making, but this is close enough to what it's going to look like that we felt that it would be valuable enough to do the training. So that is what the Google spreadsheet is going to look like and how the data is going to be provided to a provider's office.
Okay, so once you go into the dashboard and see whether or not the Mchat or the Mchat-RF is scored positive for a concern for ASD, the physician then has the opportunity to, talk with the patient as they normally would, and then also discuss resources, next steps, things like that. Our team through MICC has decided to also assist families and physicians by creating some content materials that we think would be really helpful for families when considering what those next steps are and to support them in learning how to take those next steps to getting their child into treatment services. So there are 2 content folders that can be selected by providers based on where the family is in the system. Content folder 1 is recommended for families who have a positive Mchat or Mchat-R. Currently in content folder 1, we have 1 parent video, but we will have 3 parent videos that focus on what it means to have a positive Mchat, what the next steps are to accessing a more comprehensive evaluation, and what services can be accessed right in the moment before you even know what whether or not your child has a diagnosis of autism. We also have an insurance guidance document that we're preparing. So these things will all be in content folder 1. The physician or provider is able to then go into the PEG dashboard to where we saw that resource repository and select content folder 1 to send that directly to the family, which will go to their phone. And we're going to, on the next slide, we're going to take a look at a demonstration to see how that works as well.
This is the PEG homepage. You're going to scroll down to the left here where you would see pre-populated resources folder number 1, pre-populated resource folder number 2. You're going to click on folder number 1 right now. And as I mentioned, we only have 1 item loaded in here, and that's the MICC video number 1, is my child at risk for autism. And you will click on the folder, you will choose the content. If there are more things, you can click on them each and send them separately. This little pops up, and this is how you send the materials. You can enter an email or a phone number. You separate them by a comma, and then you just click send. So for example, I will put in my email address here, and I will then receive a link to the video to watch it. Once this loads, I'll also show you what that content will look like when a person receives it. I'm not sure if you all can see this loading screen, so just bear with me for a moment. Yep, so it says it was a success. So what they will see when they receive the email or a text message is just a direct link to our YouTube channel, and it'll show that video that was created to help direct patients and families.
Okay, so just real quick, I want to give some information about other resources that are also available in the resource repository. One of the other things that we worked on through the MICC project is we assessed all of our participants within the project. So the advocates, the community leaders, the medical providers, the ABA providers, all of the people that were involved. And we asked them, what are some of the best resources that you think would be good to send to families, or also that would be helpful for providers. So we have several different categories of resources within our resource repository, and we'll be creating a content sheet so that providers know what's in those folders, and it'll kind of help to direct them based on what the external needs are. So in addition to the parent education information that's sent for that first step, where the families are just identifying that there's a concern, we also have information on for providers, different trainings for providers. We have a lot of information on Medicaid and state resources. There's some information on private insurance. There's lots and lots of training resources on ABA and ASD, as well as some information on how to access early intervention and other school-based interventions. And then lots of information on advocacy and family support. So again, if as a physician, you have evaluated that your family might benefit from having some of these resources, it was really our goal to put these things at the fingertips of the providers. I know my own experience as a provider, there are lots of resources out there. It's really hard to keep track of them. And then to take one step further, if you're not right there accessing those things, it might be really hard to then send them directly to the families in a usable way. So with this, just like we're sending information from the content folder, you can also send information to the families as a direct link to their phone for a variety of other resources. So now you're going to see a demonstration of how to select resources from the resource repository. You'll be able to see a sample of what's inside of those. You'll also get a demonstration about how to send multiple pieces of content from within the same folder at the same time. So again, this helps to save you time. And then you'll see a screenshot of resources that are sent to the parents through their text.
What I'm now going to show you is how to send files through the resource repository. Again, when you're logged into the Patient Education Genius homepage, on the left-hand side, you're going to see the resource repository. We have these organized here by categories. This may change. We're thinking about reorganizing, but there'll be similar categories, and you're going to click on one, for example, the family advocacy and support. And there's all of the information that has been provided to us through our resource repository, through members of our advisory board and members of our provider education work group, just adding in resources that would be helpful to families. And this is how you would send them. You can also send multiple. So again, you're going to click on the folder and you would select, say, I want to send link to the Autism Alliance of Michigan to a parent whose child might be diagnosed with autism. Also want to send them Autism Speaks, and maybe they're from Kent County and I want to send them Autism Support of Kent County. I've selected 3 of those. I can go up here into this little green send box, click send, type in the parent's email address or phone number, and get sent directly to their phone number or their email address. Again, separate this by the comma if you end up wanting to do both. You can send it directly to them and they will receive all 3 of the resources in real time if their provider wishes to send them to the patient. So you can also individually send one. You could just send them the toolkit by clicking send on the green folder, or the green button on the folder. So again, if you look through our resource repository, we have a wide variety of things that are uploaded in here that you could send to a family. And I'm also going to show the email that comes along with the resource repository when you send it. I'm just going to switch my share screens here. I realize I might not be sharing the right one. Okay, yeah, so here is the email address. And again, we sent those 3 resources, and they're going to pop up like this. So you can see the Autism Alliance Michigan, Autism Speaks, and Autism Support of Kent County. It's going to take them directly to the webpage. And that is how you will share information through the resource repository.
Okay, so this is what it looks like on their phone. So just like Danielle showed you, here's your 3 resources. Again, if you look here, as you open them, you'll see this bar of completion. And if for some reason they don't open them, then they will get the reminders that we talked about later. And then again, just like on your email, once you click on it, it just opens that web page so that they can review that on their own. The nice thing is it stays on their phone. They can go back and access it later. It's stored right in their text message. So I think that is a really handy tool. All right, so moving us along, if for some reason the MCHAT or the Mchat-R score is negative, then obviously the physician would just continue their regular exam, provide additional information to the family. But we do recommend that the family will complete the MCHAT again at their next well visit up to the age of 36 months. So this is something that's recommended at each well visit for surveillance of ASD for families to try to catch them early. All right, so moving right along to step 2. And if you remember on our overview, step 2 is the handoff between the provider and the Medicaid services. So again, this is a place where the families tended to get lost. There were delays. The provider might have recommended that the family move to contacting DWIHN or getting these services, but within the way that this information was provided to the families, often families didn't take that next step for whatever reason. Either they didn't feel confident, or they lost the information, or just things in their life were kind of overwhelming. So this is a way to help engage the patient, but also to provide them with a way for the providers to directly coordinate that care with Medicaid, so that families can be contacted and followed up on, again, increasing the engagement with the provider. So the positive MCHAT or Mchat-R score automatically provides a checkbox that indicates if the family is interested in Medicaid services, that they check the box. And then once they've checked the box, they've initiated this coordination of care. Again, the automaticity of the system really cuts down on the follow through from the provider as well as the family. So if they check the box, which we'll show you in just a second, they will receive a thank you message, which we'll also show you. And that thank you message will let the family know that somebody from DWIHN is going to contact them within 24 hours. It also provides them with the contact information for DWIHN. So that way, if they choose, they can go ahead and follow up immediately. So this is what that checkbox looks like. The question that pops up if they have a positive MCHAT is, are you Medicaid eligible? Or would you like to find out more information to see if you're Medicaid eligible? They can check yes or no. If they check no, then none of this coordination of care is initiated. However, if they check yes, then all of their data will be directly sent to the dashboard of DWIHN. So each provider would have their own data dashboard that would house only their own data. So if WIHN Health collects information on MCHATs from people that are not Medicaid eligible, that data stays within the dashboard for WIHN Health. For DWIHN, if they collect data outside of who's referred to them, that information would stay just in their dashboard. The information from WIHN Health, if the family chooses to go ahead and share that information, will be directly, again, the data automatically goes from the one dashboard to the other through the coding within the program. And then that information shows up so that DWIHN has access to that MCHAT. Typically in step 1 for DWIHN, they have to they have to do an MChat. So this is repetitive for the families to have to participate in this twice. With this system, they'll get that information and they can do the other parts of their phone screen, but they don't have to repeat that MChat. So if they checked yes, they're going to get a thank you message from DWIHN. That message basically says, we are happy that you are interested in getting more information about how you can help your child. You are receiving this message because you said you wanted an evaluation to see if your child has autism. The information you gave to your doctor has been sent to DWIHN Integrated Health Network. The representatives at DWIHN will help you to connect with a medical provider in the Wayne County network that can provide the services you need. You will be contacted by phone by a representative who will ask you some questions to see if you are eligible to get Medicaid services. A representative will contact you within 1 business day. If you do not receive a phone call, or if you would like to contact DWIHN directly, and then it has their phone number, as I said, it also has their website here for more information about DWIHN services. We look forward to working with you. So that message will automatically be sent to the family once they've checked that box. So this is where the care coordination comes in. Once they've checked that box and that information is then sent over to DWIHN, that a representative will then receive an encrypted email alert to let them know new information has been added to your dashboard, a family is interested. So then that representative is able to then log into that Google spreadsheet. They can then review the data. They can access all the family and patient contact information so that they can directly contact them. Only those that score positive will get the check for medication, the Medicaid transfer onto the spreadsheet. And also, as I said, each provider has their own login, so that information cannot be shared between different providers unless the family indicates that they want. The final thing that we did to also help with coordination of care is the primary care physician's name is part of that initial MChat survey. So if that information then is shared with Wayne County, then that primary care physician's name shows up in their spreadsheet as well as on the email, so that they can also coordinate care back to that physician and let them know what happened with that family. So I'll show you now a screenshot of what that email alert looks like. So you can see it's coming from Patient Education Genius. As I said, this is HIPAA compliant, and the encrypted email, it basically shows that there is a person who has an ID. This ID is going to be associated with their Google dashboard. It does have the physician's name here so that they can be aware of where that information came from. And that's pretty much it. So now they know that they can go and check that Google spreadsheet to follow up with that consumer. So DWIHN, as part of their process, will do a phone screen. So typically consumers who are contacting DWIHN directly will be screened by the method that they've always used. So they'll use their full phone screen and they'll just go ahead and follow through. But one of the nice things is, because they have access to PEG, they will also have access to all the educational folders and the content that we've created. So anybody who's coming in directly to DWIHN and they're not coming in from a physician referral can still be sent this information to kind of help them understand what the next steps are, and then encourage them to go forward with the evaluation process. That is the next step. So in order to get services, a family must then do a medical autism evaluation. So Medicaid consumers have to be evaluated by a DWIHN contracted agency in order to determine whether or not they're eligible for autism services. So if they are, and they're determined to be eligible and that they meet the criteria to get ABA services, we also have a second pre-populated content folder that helps to provide the families with the next steps if they do get a diagnosis. So we are in the process of creating another video that talks about ABA services. We also have an ABA guidance document that will be sent to the families, and some additional information that can be utilized by families who now need to choose an ABA provider. So this can be sent directly by the diagnostician following the feedback session. So once they've determined that the patient now has ASD, then this information can be distributed by those folks. For the providers in the medical offices, if a patient is not being referred to DWIHN or another Medicaid provider, then we can still give them information about ABA. The physicians will also have access to content folder 2. It might be appropriate for some of those patients to go ahead and send that information right away. Some families come in having an identified concern that they think their child might have autism and asking about ABA. So a positive MChat might then reconfirm that concern, and the physician may feel comfortable go ahead and send them information about ABA. However, if the family did not identify that as a concern coming in before the MChat, and they're really unsure, and it's not really the right time to send them information about services because they have not yet received a diagnosis, the physician can also go in and send that information at a later date. So maybe if the family calls to let them know, or if the family comes back for a follow-up and then the physician has determined that they haven't yet engaged with ABA, or they want to know a little bit more about that, then the physician will be able to send information from content folder 2. So that is the conclusion of our initial in-service. We hope that you found this useful to learn a little bit about the program that we put together with all of the educational materials, and focusing on parent engagement and improving that workflow for providers. We certainly will be following up with our provider partners with additional supports and resources for you to go ahead and get started. Thank you so much for your time.